Pain is something so many of us have dealt with in different ways, as we get older through athletic injuries or just life in general. Orthopedic surgeon Dr. Eric Novack has come on the program to tie together so much of what we discuss on the channel. And, the big goal of having surgery without the scalpel, he offers a lot of solutions. Dr. Eric Novack, I am so excited to be talking to you, my friend. I spent, almost a decade, a little bit short in EMS. And so I have dealt with the trauma and the, terrible situations over and over and over in my time there. And between that and then now having, me and McGee Market, the farmer's market health food store that we've got, and all of the people coming, without question, the digestive issues, fatigue, poor sleep, and then, of course, pain, especially joint pain is what we see so many people just looking for solutions. And then with, you take the world of Dr. Jack Kruse and all the things he talks about, you are able to speak on so many of those fronts. And I just really wanted to take the time to dive in with you being a surgeon yourself. Give us that background that you've got, how you got here, and then let's just take a deep dive into some of these topics that are sincerely going to be able to help people.
Sure. Thanks so much for having me on, by the way. I really appreciate it. I actually got my start as an EMT as well. I took an EMT course my freshman year of college, and then worked in a few different settings, doing 911 in Bridgeport, Connecticut, which is a fairly inner city kind of place, to doing rural places in Rhode Island, to working around the campus. So I started there back in the 80s, which feels like a long time ago now. And then from there went on to med school in San Francisco, did my orthopedic surgery training up in Seattle, Washington. And I've been in the Phoenix, Arizona area since 2001. We actually got here just a couple of weeks before 9/11. And that's where I've been in practice since then. And I've been remarkably fortunate. I have a wonderful wife of 26 years and two 20-something-year-old daughters who are awesome. And have had a lot of professional opportunities as well. Falling into this, the question is, like most things, they always start with a little bit of a personal story, which is, there's a lot of things we can try to do in life, but stopping the clock isn't one of them. And I kind of found myself a few years ago just not feeling good. I was always in pretty good shape. I had done the long distance triathlon, ultra marathon stuff in my 20s. And then, like a lot of people with work life and young kids, kind of got away from it 10 to 15 years and then started getting back into it. And I actually hadn't noticed that every time I got up and down from the kitchen table, I was sort of moaning and groaning, and my kids would always make fun of me for it. And then there was a sudden realization. I can't tell you the number of patients who come in and say, oh, my primary care doctor or so-and-so told me it's just because I'm getting old. And it is my firm belief that just because we are getting older, it is not the natural state of humans to be hurting. And so I really began what's sort of a several-year-long self journey and discovery. And I'll tell you that it really started not so much, I'd say, with everything that I'd say is some of the foundational stuff that Jack Kruse talks about with Circadian and stuff. It really started with a personal journey on the mindset and meditation piece of it. I'd say like a lot of orthopedic surgeons, we tend to be fairly straightforward. If the bone is broken, let's fix it kind of stuff. But then you discover over time, and I'm sure you see it as well, people getting better had a lot to do with everything but what we did to them. And what we all would say to each other is, well, if this patient doesn't want to get better, the best operation in the world isn't going to help him or her. So my personal journey kind of started with mindset. And then I would say I actually went through the supplement phase, spending God knows how much on how many supplements every single day. And just kind of, as I kept reading and trying to learn, and kind of fell into this, for the basic issue being, we spend about $4.4 trillion in the US on healthcare at this point. I mean, the numbers are so staggering. It's insane. In spite of that, we are sicker, fatter, less happy than we have ever been. That is just factually true. So we're doing something fundamentally wrong. And, we live in a healthcare system where the incentives are so screwed up, and we can talk more about that as time goes on if you'd like. But that's sort of how the journey began. And, I've been trying to think about how I initially fell into finding Dr. Cruz's stuff, because I think for a lot of people in this space, he became kind of the North Star, at least for learning and education, even though the depth and breadth and scope of what he talks about is almost overwhelming. I'd say even for a guy who feels like I can read and study and memorize pretty well, it's a challenge every day to try to read it. But once you get into it, you start saying, you know what, this actually makes sense. And so that's really how the journey began. And what I discovered as I've talked to people like Max, Ghislaine, and others, is that it turns out there's really not people who are orthopedic surgeons who are out there talking about this. When after upper respiratory issues, the number one reason why people see a healthcare provider of all kinds is related to musculoskeletal pain. So that's kind of how I got to where I am today at the very high level.
And that's one of the biggest reasons why I wanted to talk to you, is you can speak to all those fronts. And while I am hypercritical of the medical system, right? Like I've been around it my whole life, and between the pharmaceutical side, EMS, I see the miracles, right? I was working EMS in the state of Arkansas when we established the trauma system, the Arkansas trauma system. And so I got to experience how the communications changed. I've seen how people that I had zero doubt, or I knew they were not going to make it, right, were saved and put back together. It's incredible. So I want to definitely give credit to the trauma side, the acute side of medicine. It's incredible. But the chronic side, as I've experienced through the cancer journeys, all the people in the family and that come to the market that aren't getting solutions, aren't getting answers, that's what we are failing miserably at. And I think it's all, it's the system. It's the system. So I'm trying not to be as critical on the doctor specifically as I am the system. But once we know better, we've got to do better. And so let's start with your practice. What are you going to see the majority of the time that people come in and have the complaints and the issues for? And then let's go through what do we do? How do we avoid? Because I love how you've said with Max, the best surgery you can have is the one you avoided. All right. So if we can lay that out, maybe we prevent a tremendous amount of suffering.
Sure. I mean, I have an incredible luxury in 2024 standards of being able to be a general and trauma orthopedist in a big city. The nature of the world, as I'm sure you know, it's not just in healthcare, is everyone gets more and more and more specialized. So the world at this moment in time, in general, rewards people who are 1 inch wide and 10 miles deep. And honestly, that's a point that Jack makes. And if you look historically, the reality is that sort of the great thinkers tended to be, a half mile in either direction, if that makes sense. Because that ability to look beyond your only tiny corner of the world with some measure of expertise or some measure of knowledge gives you a better perspective. So also a little bit similar to Jack is that I end up migrating, doing a lot more trauma. I'd say a little bit more than half of what I do is level 1 trauma here in the Phoenix area. Because as you noted, the decision-making is fairly straightforward, if that makes sense. We don't always get the outcomes we want. We can't always guarantee what's going to happen. But if you wreck your motorcycle and your femur's sticking out through your leg and you're having pain and you say you can't walk, there's pretty much no question of what the problem is, that you broke your femur. Now, there can be differences in how you approach it. There can be differences in how it's done technically. And of course, there are differences in outcome. But that's the nice thing about acute injuries and trauma. But the rest of my practice is, I'd say, ages from 2 to 102, from things that hurt, whether it's semi-acute, the teenage athletes who've been having knee pain for a while, to the 25-year-old who is who's working out on the weekends and has shoulder pain, to the 45-year-old woman who's trying to get in shape and now her knees are hurting her, to the ever popular these days, 65 or 70-year-old man or woman who's playing pickleball 7 days a week and things are hurting. So it's the full range, all the way up until folks who are 80s and 90s and having issues with knees and shoulders. So I'm incredibly fortunate and have been incredibly fortunate over the last 23 years to see a pretty wide range of patients, ages, and problems. And the first thing that, as you noted, I always say when I talk to students or people who come through, which is there are a couple of laws, I think, that have to deal with surgery. And the first law is always, the first law of surgery is always humility, because we can do the greatest surgery in the history of humankind. And honestly, all of us who are surgeons have had cases where we do them and afterwards, we're dislocating our own shoulder, patting ourselves on the back for how incredibly amazing we are that we did it. And the outcomes sometimes are crappy, honestly. And again, anybody who is looking people honestly in the eye will have surgeries where you come out and at least you say to yourself, that may not have been the best that I've ever done. And the outcomes are amazing. So I think humility goes a really, really, really long way. I think surgeons a lot of the time cover it up with bluster and ego. But I think the best surgeons, even if they're outward facing, is enormous ego. Internally, I think you have to have humility. So that's law one. And then the second law of surgery is absolutely positively the best surgery is the one you've never had. I know you that is the most important thing to know. And the way you know that is that people who are surgeons try to avoid having surgery. If it was so wonderful, we'd all have a really, we would get our own knee and shoulder done at the drop of a hat, and we try to avoid it as much as possible. So from a personal philosophy perspective, I think that's how you try to approach patients, because it is true that I think surgeons have and deservedly to a degree, because the incentives in the system are bad, that we do surgery. It's what we like to do. And so, well, you can find a reason to operate on almost anybody for anything. And so I don't like the idea of my patients coming in trying to feel too defensive, that I'm trying to sell them on an operation whenever they walk in. I mean, every patient over 45 or 50 who has knee pain does not need his or her knee replaced, for example. Even though you have that impression these days, given that we are up to about 700,000 joint replacements per year being done in the US. And the analysts, the ones who really matter, the Wall Street analysts who control these public companies that sell the implants, are very confident that those numbers are continue to go up at a much higher rate than you'd expect. So long story short, that's sort of the brief background. I don't believe volume makes you better, but I do think experience can give you, if they say what quantity has a quality all its own, I'd say over the last 23 years or so, I've probably, easily done probably over 110,000 patient visits and probably about 15,000 operations. So that makes me still remarkably imperfect. But there's a large denominator I feel like I have to go on to having seen how people can do for better or for worse.
Yeah. Well, yeah. So let's dive in to more of a more generalized but specific case. Let's say we've got a 65-year-old grandmother, right? Because what I've noticed is that's who comes to me first most of the time. And they're worried about their husband that's diabetic, prostate issues. She's got knee pain, just not feeling real good, the fatigue, trying to get healthy but can't because her knees hurting. The grandkids are either have autism or ADHD. Something's going on, right? And they see it. They know something's wrong, but they come to you for this knee issue. What conversation do you start with?
So I think the highest level is to tell people, and I say it all day long. Again, it doesn't matter if it's that 65-year-old. It doesn't matter if it's a 17-year-old who's got knee pain and football season's about to start, which is, I think you need to look people in the eye and say, just because you're hurting today does not mean you're doomed, for the 17-year-old, to another 90 years of knee pain, or the 65-year-old, you're not doomed to another 40 years of being in pain. Because that mindset piece, the belief and understanding that you can get better, and that your natural state is not to always be in pain, is critical. The ability of our brain to control our reality to a large degree is one of the great, we've not only ignored it, but I'd say the last 70 years of Western medicine has actively suppressed that component. So you need to have a mindset that I'm not doomed and I want to get better and I'm willing to take the chance to get better. So that's number one. So I always like to start with that because, as I said earlier, that patient or that person who doesn't want to get better, I don't care what we do to them or offer them or tell them or give them. That person has a very, very, very low probability of getting where he or she wants to get to. So that's sort of number one. Then you try to get an overall sense. Well, what do you like to do? What is it that you're trying to do? Because that's important, right? Because your 17-year-old who's a football player has a different level of demand than maybe your 65-year-old whose main thing that she wants to do is be able to get up and down off the floor to play with her grandkids and be able to go on walks, as opposed to the 65-year-old who still is doing ultra marathons. So understanding where people are and what they want to try to accomplish is important for the background as well. So that's, I'd say, is the background for folks. And then, of course, in orthopedics, so plainly speaking, if we just talk orthopedics, once you get past, which that sort of still seems kind of high level, I think, for people, practically speaking, when you show up in an orthopedist office, if you don't have an x-ray when you get there, generally speaking, if it's your knee is the issue, you're going to have your knee x-rayed before me or one of my colleagues would ever walk into the room. Because basic imaging is the fundamental mainstay of Western orthopedics in 2024. Doesn't mean every patient needs an MRI or advanced imaging, but a basic X-ray is still the initial thing. So we get some sense of baseline because there are a lot of people with pretty normal anatomy who have terrible pain. But equally true, there are a lot of people with pretty horrible looking anatomy on X-ray who don't have much pain. But anatomy isn't destiny, but it can help guide us to a certain degree. So that's the thing. You want to kind of see what the anatomy looks like. And then you basically examine people and talk to them and see. This is what I've started telling people. And I guess this is sort of the meat of a lot of our conversation today, which is I try to get a sense of people. What are they doing? What is their basic sense? Do they have trouble sleeping at night? That's one of my first questions. Do you sleep at night? How much of your time after dark are you on the phone or on your television? Does Netflix go on the second that you walk in the afternoon and stays on until you go to bed? And what do you do when you get up in the morning? Those, I think, are my initial questions, just to get some sense. And then I do talk to them a bit about diet. So here's, again, we'll just keep walking through this example of, let's say we have a 65-year-old woman who, is in reasonably good health, who's got a lot of stuff going on in her life, but everyone does, who wants to be active. We're going to put the 450-pound brittle diabetic who's on oxygen. Let's leave those people over to the side. I do ask them about sort of food. Now, the difference of someone coming to see me who works completely within the traditional third-party U.S. healthcare system, and let's say someone like Jack down in El Salvador, or a lot of the doctors I listen to on other, who talk on podcasts, who have direct primary care or other kinds of practices. When people come to the orthopedic surgeon in my setting, most of them haven't spent a whole lot of time doing any out of the box or non-centralized thinking about their healthcare. So I do need to be a little bit careful and give a little bit of a preamble before I launch into stuff. because you can watch people's faces and you can see if they're somewhere between shocked, offended, blown away. The people who go into some of the sort of non-traditional MD offices, they're already primed to hear a different message. A lot of them are expecting me to say only, let's do a cortisone shot and then replace your knee, right? That's what they expect to hear. So continuing going down this road, then I'll say, well, one of the things I think we can try to address some of your short-term pain, but your goal is to be able to play with your kids and be active for as long as possible. And there is a remarkable amount of anecdotal evidence that very short-term, the single most effective way to improve musculoskeletal inflammation is to go to a low or no carb diet. The amount of anecdotal and increasingly actually published data is so overwhelming. It is infinitely better than any anti-inflammatory they can ever take. Now, it might take a longer ramp-up time, and it's a whole hell of a lot more work than just popping 4 Advil 3 times a day, but it is the single most effective way to make people feel better. I'm pretty much guaranteed. Now, the more medical issues you pile on top, I think the longer it's going to take to start to see those things, but I am 100% guaranteed for just about everybody it will make a difference. But I tell them, you're not making this decision for life. I'm not telling you to give up all carbs for forever. I'm just saying you've been hurting for the last 8 months, and you just spent the last 5 minutes telling me how miserable life is because you can't walk the dog and you can't play with your grandkids. Really? Is it that much of a stretch, to just have no carbs for 2 weeks? The looks on most people's faces, you'd think that I just, told them that I was, that they had to sell their child or grandchild. So that's step one. I do believe, and this is what I'm telling people, short run, significant diet change to low to no carb, which means high protein, high fat, no processed foods whatsoever diet. For most people within 1 to 2 weeks, they're going to see a massive change in their symptoms. And I tell them, I'm not telling you to do it to lose weight. So that's step one. And then I tell them, then I say what I'm sure a lot of other guests have talked about as well, which is the data on trying to match your circadian rhythms to nature, we know is the most anti-inflammatory thing. Most people have heard of melatonin because frankly, most people can't sleep and are taking it. And I try to tell them that you have to try to simplify it a bit, in part because I can't do Jack's level of depth, and in part because if you get too detailed because you're trying to make yourself sound smart, patients walk away knowing nothing. So I do tell them, look, melatonin, the major job of melatonin at night is to act as its repair and anti-inflammatory mechanism. So when you're watching your TV at night to all hours, when you just have a TV on in your bedroom as you're laying in bed, even if you're not really watching, when you're on your iPad to all hours, when you're looking at your phone when you can't sleep all night, all you're doing is completely eliminating your body's ability to do its own anti-inflammatory efforts overnight. So you need to be willing to give that a trial as well. And I say, try 30 days. When it gets dark, have it be dark. I'm not saying you should just sit in the dark and do nothing until you fall asleep, but try to dim the lights, read a book, do something, but stay off your devices no matter what. So that's number one. Number two is you have to get up and see the sunrise. And again, they look at you like you are absolutely insane. And I say, go outside, sit outside, have your coffee sitting outside with your feet in the grass if you can help it. Don't wear sunglasses, don't wear sunscreen. In Arizona in the summer, that's not a tough sell for lots of people, particularly if they're older, because they tend to get up early and it gets so hot here that people tend to be up early. And then I say during the day, if you're going to be inside, get a pair of blue blocking glasses. And to the extent that you can get outside, even if it's for 15 or 20 minutes to get your body exposed to the sunlight, that's what you need to try to do. When it's 112, like it was here yesterday, normal people, they're going to turn off if you tell them, work your way up to spending 45 minutes outside at noon. They're going to go someplace else. So summarizing all that, that's what I tell them, which is I beg you to consider 2 weeks of a no carb diet to see if it makes a difference and begin to take some of these steps. Now, for the purposes of today, you've got, mild arthritis in your knee. You're having lots of pain. If it's really hurting you, steroid injections, which have a bad rap if you start searching online, it is the single most common procedure in orthopedics in probably the entire Western world by a factor of multiple zeros. And isolated intermittent steroid injections into joints, I just don't see the downside when the upside, the relative risks, the upsides for the majority of people are so significant. A lot of folks, more so shoulders, which tends to disrupt sleep more than knee pain. Shoulder pain, the number one complaint usually is they can't sleep. And there's probably a 70% chance that we make a massive improvement in sleeping just with an injection in the shoulder. So, steroid injections. And then, of course, we also do encourage people to stay active and do it. So we also forget, and we tend to be so paternalistic that we kind of know what it's like to exercise. But the vast majority of people, it turns out, they don't know what to do. And social media has, in fact, made it, there's almost too much data. So I recommend a lot of people to go to a little bit of therapy just to learn what to do and do home exercises. So that was kind of a long-winded answer, and we can sort of dive into each piece of that and get deeper in some of the whys at each step. But that's probably the initial thing. And then I always tell people, let's regroup in 6 weeks. Same, better, worse. If you're getting better, cancel the appointment. It doesn't make sense to pay a copay to tell me you're feeling better. But if you're not feeling good, let's sort of regroup and say, okay, what's working, what's not, and go from there.
Wonderful. Yeah. And I gave you the example of the grandmother with the family issues because I think that it's a way to emphasize environment, right? The environment in which we're all living lead to these issues. And I do want to go into kind of more of the reasons behind that. You hit on melatonin, which I was first made aware through the cancer lens, right? Using very high doses of melatonin in active cancer has been a game changer in a lot of situations. Now, obviously, when we're healthy or we're working towards that, we're not dealing with active cancer, that's a different situation. But you hit on light and circadian lifestyle. And I think that is something that I've just now started getting people to realize in the way at which we communicate with them to get it. And it's pretty simple in the positive reception I've got when we say, well, what did your great grandmother do? Right? Well, do you remember when you were a kid and you were always outside playing and you never heard of any of these issues? You were outside, you were barefoot, you were running around. Were you healthier then, or was this going on? And when they get that click, I remember grandma was doing stuff that maybe we thought was a little weird, but we were playing outside and we were being active with nature. And we didn't have all these problems. So let's go into a little of that, Dr. Novack. Why was it when we were barefoot, running around in the sun, on summer break or whatever, were we healthier than sitting inside 90+% of the time behind artificial lights?
You're right. I like to say if we could just sort of bottle up those grandmotherly one-liners, we'd be infinitely healthier at a fraction of the cost. One of the things that most of us in healthcare and medical school, we tried to avoid, we tried to avoid physics and we avoided evolutionary biology. Those are the two things, because they didn't make any sense to us. It was much, when I was going through it, it was much cooler looking at lab values and listen with stuff, the very mechanical things of medicine and biology were what were cool and sexy. And physics didn't seem like it applied much. And evolutionary biology, God knows, I don't even know I ever thought about it ever until the last 18 months. The reality is we evolved under natural sun. We didn't have big houses. We evolved being outside, and we evolved outside over the course of the seasons. And if you have a different view of the origins of mankind, I think it's right there in the first, from the very beginning that, it was there was light before there was man. And so I think you can come at this from different, either theological or other direction or evolutionary directions to say light and sun somehow are there and are fundamentally important. So we evolved under natural light. And what does that mean? Well, the wavelengths of light, which we look out there and all the blended colors that we can see, from the wavelengths we can't see on both sides, UV on the one side and infrared on the other, and beyond, that's what we evolved under. And the great message is that not only did we evolve under those, but our body's designed to take advantage of all those different wavelengths. And they're designed to take advantage of all those different wavelengths in the proper blend, because that proper blend of wavelengths is like the recipe that our body is using to cook up what we need together. So, I don't know, to make a bad analogy, it's like, going to make your brownies and you're going to just use butter, but forget a whole ingredient. Probably the brownies aren't going to be so good or be so edible. And so the modern world has gotten us away from that. So what our grandmother said, which was go outside, don't come back till it's dark, call when we tell you to, because a little discipline matters as well. Eat the food that's in front of you, which sometimes was maybe not always the most palatable, but in that era, it wasn't the stuff coming out of metal containers or boxes. Go to bed early, get up early, and do productive things. Those basic tenets of what our grandparents, now I'm not sure what generations forward grandparents are going to be saying, because I guess we're getting there, but our grandparents, like that's why we think people are healthy. Obviously, you go on social media and you can't help but see the pictures of this is what the beach looked like in the 1960s, and this is what the beach looked like today. What's different? Well, all the data that's out there suggests that it wasn't like we were eating fewer calories in general in the 60s and 70s. And God knows I did not have the healthiest diet growing up. I mean, I remember as a teenager, I ate an entire box of Entenmann cookies every single day when I walked home from school. Every single day, I'd have a whole box of those little awesome Entenmann's cookies for years. But we were outside all the time. And honestly, I wasn't lathered in sunscreen. I didn't really tan at that point. So I was covered up a lot, but I wasn't lathered in sunscreen. I was up early. We got to school before it started and played outside. We were always outside for recess. We had no phones. So I think that's that's the basic story of light, which is we are designed to be under light and under natural light. So then let's look at today. Well, for your average, again, we can do everybody, but you can look at the two extremes, kids, and now let's look at the older population, which is people are inside more than they've ever been, number one. Number two, I have to say that the over 65 crowd, in many cases, are as or more addicted to technology than any teenager. The same people who couldn't use their cell phone are now literally on their iPad 24 hours a day. They're the ones who have the cable news station on 24 hours a day. They can't sleep at night, so their TV's on in the bedroom all night. So they are being exposed. Not only are they not getting the natural wavelengths of light that they really need for their body to use to power the systems properly, to not only give us the energy for the things we need to do, but to set the systems up for repair. But also they're getting all this unbalanced stuff. And that's where you hear about this blue light toxicity, right, in folks. So we need blue light, but we need blue light that's balanced with the other wavelengths. And when you have blue light alone, which is what our indoor LED lights are full of and what the LED screens are on our TVs and iPads, that's having an adverse effect on our energy production at the mitochondrial level. And then that goes downstream to make us more likely to have the diseases that Jack talks so much more about, because there has been this massive explosion in neurodegenerative disease. and all of these other things we see. And I'm going to make the strong case that all of these musculoskeletal conditions, it's not just because we have too many orthopedists looking to stay busy. It's not just because J&J and Smith & Nephew and Stryker spend a lot of money on advertising. It's not because patients want instant gratification. It's because the light environment is not giving us the ability to both sustain and repair our joints, our cartilage, and our tendons. So we're having more injuries, worse outcomes, and more pain at younger and younger ages.
Again, love it. It is much easier to accept that the sun has all the positive abilities, right? The positive impacts. It's much harder for people, in at least in my experience, to see the negatives of the artificial light and the screens, the devices, the technology, right? And that's even a side note of the non-native EMFs. But
right,
how I think one thing that's glaringly obvious is the kids or the younger, even teens, having all kinds of athletic injuries like crazy. Like I feel like even 15 years ago, 20 years ago, we didn't have somebody tearing their ACL every game, right? We didn't have kids having to have Tommy John surgery, and maybe there's something else to it. But in your experience, what is that connection, right? What is the connection of the kids having such extreme injuries frequently, right? Extremely frequently, and all of this that we're talking about?
Right. I think this, as much as the 65-year-old is critically important, this is for parents out there, or if there's teenagers watching this, or men and women in their 20s and 30s, this, I think, is the real meat of it. So if you talk to other orthopedists, and I've tried to, and I'd say, what do you think is behind the exponential rise in, number one, ligament injuries in teenagers? And two, the fact that when I trained, when we looked at, let's say, the demographics or who was likely to get distal biceps tendon ruptures, Achilles tendon ruptures, patella tendon ruptures, those were generally diseases of certain decades. And when I was a resident, and even early in my practice, if you tore your Achilles at 35 years old, we went looking for some other secondary cause that would make your tendons be weaker at 35. Now, the age of these injuries in adults is coming way down. And of course, you have the explosion of injuries in kids and teens. So one, I would say when it comes to those injuries in the 20s and 30-year-olds, nicely put, orthopedic surgeons don't really care why. It's just that we'll fix it. For the teen athletes, the argument is, well, A, it's happening, so let's just fix it. We don't care about the why because it's a good way to keep us in business. We're happy to stay busy. And it's just because there's more and more specialization of single sport kids at younger ages. And there's probably something to that. As the intensity of youth sports has gone up, particularly with all of the different traveling teams, et cetera, at 10, 11, 12, if you're a volleyball player or a softball player or a baseball player, you're throwing. They want, the pressure to throw year round or get those arm motions year round is really high. So that is definitely, that's what we'll blame for it. But I throw out there exactly what we've been talking about, which is the data. There is real data that says non-native EMF exposure, which I will explain as completely unbalanced light exposure from being inside all the time, because even our athletes are either inside all the time or they're covered in sunscreen, so they're not getting natural sunlight, and non-native EMF from having their cell phones around them all the time and their iPads and their laptops on their lap all the time, and then working on their laptops when they're at home to do their schoolwork. So the data that non-native EMFs have an adverse effect on cells and cellular function, or going one level deeper, they have on the ability for cellular redox, our body's ability to manage energy. And the failure of proper energy management is what ultimately leads to disease, is incontrovertible. So that this idea that our kids, whenever they're not in the game or in practice, they're on their phone. And they're on their phone the whole way to the practice. And they're on their phone the whole way home from practice. And then they go into the room and they're on their laptop doing homework all night. And then they're on their iPad watching YouTube until they go to sleep. And then they get up and the first thing they do in the morning is get back on their phone to be on social media. So that has a absolutely enormous impact on our kids' abilities to heal. And that doesn't even get to the hormonal disruptions that we know that excessive blue light can have through the hormonal system, which is why we're probably seeing some of these kids go through puberty at 9. And on the flip side, while we're seeing, such a difficulty with people getting pregnant in their 20s or so. So there's a massive hormonal disruption that when your body's growing, well, that also impacts your tendons and ligaments and joints. So that it's a message you try to tell people. If trying to convince people, if you can imagine the looks I get from telling people to have no carbs for 2 weeks when they come to the orthopedic surgeon to make their knee pain get better, as opposed to me just injecting with something or doing an operation, you can only imagine what I get teenagers and their parents. And I tell them, you need to be up and see the sunrise every morning. I don't care if it's just for 10 minutes, but when you get out of bed in the morning, go outside, stand outside for 10 minutes, then come back in if you want to get on your phone. And at night, selling people on wearing blue blockers, everyone leaves the office saying, oh, yeah, sure. I don't know if it actually happens or not.
Right.
I'd throw one other thing out there, by the way, just with this whole ligament injury thing that's important. And from a personal side of things, that also helped me get into this whole world. So my daughter, who's currently 21 and is wonderful and awesome and is a great skier, she tore her ACL skiing when we were on a trip a year and a half ago. And again, I'm an orthopedic surgeon, and I've got a good friend in our group who's operated on me and my wife, and I've known him since training days. He's a wonderful surgeon, and so he's going to do the surgery. And one of the things that I've noticed in my practice recently is the number of people in their 20s and early 30s who had their ACL done within 5 or 10 years, who on X-ray have horrendous arthritis in their knee. Horrendous. And that's crazy to me, because if we're making people's knees more stable, shouldn't we be protecting their knee against future degeneration? And the sports orthopedic world doesn't really have we don't really know why. There's not an answer. So it's also how I started on this big journey, which is, well, how do we try to protect what's the answer for that? And I don't have a perfect answer for how to solve that, but it's something I think that everyone out there should be aware, which is, of course, we need to make people's knees stable if they're going to be if they're going to continue to do sports. But it's another reason I think people should be looking very carefully into what is considered alternative approaches, whether it's red light treatment and some of these other therapies, and making sure that you maximize your circadian harmony during your recovery period. So we give your joint and the best opportunity to heal.
We're not recovering at all in athletics, and it's not recovering in any meaningful way, right? Like taking a day off and going and doing exactly what you just said, right? Like that lifestyle, that's not recovering. So,
Right.
Curious your thoughts and tying this together. Let's go with Dr. Robert O. Becker and his work, Body Electric, and I mean he's done a tremendous amount of work. It's not just that, and then of course Andrew Marino. The idea that the bone is a semiconductor, right? Or all the fascia, right? Is a semiconductor, or we're able to transport electrons through the body. I think that's something that most people can't even rationalize, right? And so when you discuss things like you've mentioned the red light, which I mean, sunlight that we don't get, the grounding, why that's an impact, why the
Sure.
magnetochemistry that is something that we never discuss. And I think that, I think it's even harder to grasp than the light side, right? The electric side. But a lot of these kids are either playing inside, right? Or they're, wearing cleats and sunglasses if they're outside. And that completely disconnecting from nature. So can you wrap it together what that means for the body to be electric, and the bone has a, piezoelectric capacity, and then without throwing too much on you, the role of in one question at least, the role of, say, vibration plates, right? I know Jack hates them. He's like, it's useless. But Dr. Novack, I've seen it just absolutely be so impactful for people with neuropathy, even actually psychological issues. So can you tie all that together for me, Dr. Obecker, the kids just being completely disconnected, and then even if you can throw in something on the vibration plate?
Sure. As an orthopedic surgeon, you'd think that we all would know about Robert Obecker because he's an orthopedic surgeon by training. The background, he was an orthopedic surgeon who ended up as a predominantly researcher at the VA in upstate New York for a long time. And he was the one who did the building on other people's work, but did this foundational work that said, hey, number one, in mammals, so in humans, when we heal a fracture, we're actually not even really healing, we're regenerating. So bone, and again, as an orthopedic surgeon, you can still be a big macho orthopedic surgeon and get that tiny bit of geekiness for it to say, hey, it's pretty cool that the bones are the one part of the human body that truly regenerate, meaning it turns cells that were something else into bone cells to heal a fracture. That's his work. Also part of his work is a recognition that electrical signals and the electrical potential is fundamental to life. Now, none of us in training or in medical school ever heard of Robert Obecker, and I don't think any other orthopedic surgeon I know of has ever heard of him. So he's kind of been ignored. And so we think about that and we'd say, why is that so controversial? Well, it was controversial at the time because particularly, I'd say that one of the hallmarks of the sort of post-World War II biology and medical establishment was that the body is really just very mechanistic. We had DNA, and the DNA turned into proteins. It was a very mechanistic view of life. And we have progressively denied anything beyond ourselves, whether it's religious or otherwise. And we had to deny this whole concept of vitalism, that there was some kind of spark of life that was part of a big debate. So that's kind of that, and the vitalists lost out really in the 20th century, even though some of the biggest names in physics who helped develop and define quantum mechanics, many of them also talked and wrote about biology because they felt there was a direct connection between some of these quantum properties and what life actually is. And Becker, in many ways, I think of it as kind of building on that and recognizing that the fundamental particles of physics are the fundamental particles of life, and how they function is how we function. So that's, I think, and so he's been sort of ignored today. So that, I think, is a bit of that initial background. What does that really mean practically speaking? Well, it turns out that another question I like to ask people is, define what being healthy is without using the terms absence of disease or absence of injury. It turns out that defining healthy is very, very hard for most people, even doctors, if you don't allow them to use the negative of something else. So again, people far smarter than me, I think a reasonable way to look at it is that when our body at all of its multiple levels of both time and scale, because we go from individual electrons going down the electron transport chain to make ATP, to the behavior of water molecules and electrons, all the way up to whole organs and our whole body as a unit, and also both in scale of size. And again, joints and bones and muscles and tendons are all part of that. Also in terms of time, right? We think in terms of millions of different things. We have, and there are things that go a whole lot faster than this. If you look at theories of consciousness, you're looking at things that go at 10 to the minus 15th. So that's so inconceivably small. But if you think of ATP, that's spinning, cytochrome 5 is spinning 9,000 times a minute, all the way to things that take a lot longer, like, well, our lifespan. So we range these enormous, we span these enormous distances, both in time and size. And we have to have a degree of harmony between, so when there's a good flow that is in harmony for energy at time and size, that's what our health is, right? And that can work from what our mental health is. That's how even though it's not a bumper sticker, can say that's how we harmonize the mental to the physical. And what does it come to? And now bringing that together, what does that mean? Well, the currency of life is still electrons and protons. That's what it is. We'd like to say it's the electron transport chain. It's not the glucose transport chain. It's not the I had a steak for dinner transport chain. It's not, it's not, right? It's not even the, hey, I had a glass of water transport chain. So we ignore that. And so the question is that the currency of life is actually electrons and how we manage our electrons, because those differences across membranes, and across different surfaces, across different sizes, that's the battery that powers our life. So in bone, it just happens to turn out, because bone's pretty cool in the end. We're not here if we didn't go from being an octopus, right, to being humans and having our skeletons on the inside, right, or having a skeleton at all compared to an octopus, right? That's a big change, how we're up and moving around. It turns out that bone signals internally, externally, with the fact that when it changes temperature, changes shape, change in pressure, all those things actually cause the fundamental makeup of bone to not only do an electrical charge, which can send information locally and globally in the body, but it also creates light. Because, again, hard to get people's brain around, but when we take something and it's changing from one level of energy and then it drops back to another, it can release light. That's a basic principle. So we can absorb energy and release it as light. So we know that bones do this. One of the cool things, again, this is a brief aside as I babble on with this, is tetracycline, which is an antibiotic, which is still used quite a bit, is no longer used in children, because it turns out that tetracycline is taken up into growing bones. It also turns, and so that was felt to be a bad thing. Now, I'm no dentist like Jack, but it also got taken up into teeth, so it could discolor teeth. So we don't use tetracycline in children. I don't see it in younger people. I will see it in some people who are from other countries, and I will see it on occasion with people who are older. It's really hard to describe, but when you get in there to operate on people, the bone almost has like a slight yellowish tinge to regular light, to the light from the operating room. So I went down to the hardware store and bought a little black light, which is great here in Arizona because you can see scorpions because they fluoresce and you can kill them. But you get a black light. And so whenever it happens, I have someone run to my locker and grab my little black light flashlight. We turn off all the lights in the operating room and you shine this black light on the bone, and it fluoresces like those inexpensive fluorescent nightlight things that you can get as stickers for your kids. So bone fluoresces because normally it doesn't fluoresce where we can see, but for people, well, it does fluoresce in different colors. But when people have had tetracycline, it incorporates into bone. So when you excite it with the photons at the UV range, it then releases visible light. That's just a simple example of it. So The short version, sort of the TLDR version, is we run on electrons. When we're outside barefoot, we actually can absorb electrons from the earth. It sounds foo-foo and crazy. It is simply true. That's why it makes sense to be barefoot. When we're outside under normal sunlight, we can take those massive array of different wavelengths that makes up natural sunlight, and there are different things in our body at different depths that can absorb that sunlight, and it converts that sunlight through the photoelectric effect by being able to take those certain wavelengths that it's sensitive to, and then convert that either to a different electrical signal or to emit our own light internally to signal. That's astounding to a guy who's been in healthcare since I was 18 when I first saw that. Like, you got to be out of your mind that could possibly happen. But you start looking deeper into the things that it was said in the literature, and Jack has done really, I mean, there's not really words to describe sort of what he's done to help bring this to the masses. And then you say, it's impossible to believe that the body is not using those electrical signals from wavelengths of light and the light we emit internally. It's impossible to believe we're not using that to help maintain this incredibly complex web of homeostatic systems. Now, if I had that conversation to some degree with every patient that came in, I'd go out of business in about 2 days. And people would walk out having no idea what I just said. So I know some of this conversation is like, how do we make this practical?
Right.
So the practical thing for your teenagers who are doing sports, which is, I know kids don't like getting up early and they need their sleep. I don't care. Roll them out of bed, make them go sit outside without their phone. Don't let them use their phone. And just simply say, you want to be on your phone today? You need to be outside for sunrise for 10 or 15 minutes. Then go be on your phone. When you're on your phone or on your laptop at school, we'll buy the coolest ones you can find, but we're going to make good blue light glasses the coolest thing in school. So when you're inside all day for school, whenever you're looking at your screen, you're using blue light glasses. When it's lunchtime, you want to be on your phone, you cannot be on your phone unless you're outside. Because then you're getting, that's why I don't have to, when we're outside, the blue light from this screen doesn't matter so much because I'm sort of being pummeled with everything behind me here sitting outside. And at night, you got to wear your blue light glasses. If you're a teenager and you've got 4 hours of homework a night, it's all on the computer these days. We just have to live realistically. So get good blue light glasses. And when you go to bed, put your phone on airplane so you're not zapping your brain all night. I've tried to convince my wife and kids that Bluetooth headphones is really horrible. I have not yet had success. But they're absolutely making people less healthy.
Now, family seem to buy in last, I think. But for all the reasons, I mean, everything you just said, I think is something that we all should, do. That should be everybody's kind of operating system. For everything that you said with the kids specifically, that's why I homeschool. Actually,
Right.
Is the environment. It's the light environment. That's number one reason for me. There's plenty of other reasons people have, but it's the light. Outside of when I'm in studio, I'm outside. My farmer's market's outside,
Right.
and so like I live it too outside of, when we're doing these. But any thoughts on the vibration boards, positive or negative? And then if as we wrap this up, if you can just kind of super high level tie in why melanin is important to this entire conversation.
Absolutely. So with what I would consider from the orthopedic side of view, a lot of what sort of adjunctive treatments, therapies, et cetera. So let's look at sort of vibration and stuff. Well, even at the very, very smallest subatomic level, everything vibrates. It's probably not vibrating in the way we think of it, like a vibration board, but we know that vibration and oscillation is fundamental to life. We also know that sound, which is also, sound waves are also just oscillating and vibration, are absolutely useful for mood and recovery and healing and pain relief. And that stimulation can make a difference. And as you kind of touched on fascia, this idea that pain that we're having, here's how I like to view it a lot, which is that, and I tell patients this all the time, which is the signal, what we're trying to do, I can't take my 54-year-old knee and make it a 12-year-old knee. I can't. So sometimes I can't make the anatomy back to what it was 40 years ago. So sometimes I believe when we're having pain, it's like those old pinball machines that would go on tilt. And what we're trying to do is give people the tools to help reset the system so that the signals that are being sent are not sending pain signals. And so I do believe there are many different ways to skin that cat. So if we think about vibration boards, or if we think about PEMF therapy, or we think about dry needling, or we think about cupping and some of these other treatments like that, I'm a big fan. I tell people all the time, you know what? If you want to shake the head of a chicken at it, if that makes your knee hurt less, that's all that matters, right? Because the academic part of it is fine. But look, I'm not a car person. I just want my car to get me to work and back and forth, right? I don't really want to know. I just don't have the bandwidth to care about every detail inside the car. And trust me, here in Arizona, my air conditioning, I don't honestly need to know every facet of how that air conditioner works. It just needs to make it cooler inside when I turn it on, right? So I don't need to try to boil it down to people. We know that a lot of people get benefit from the vibration thing. I've seen it. There are a lot of different things that make things feel better for people. And I don't have to try to give an answer to everybody for why it does. It's nice academically. So Jack's point, sort of getting it back to the circadian piece of it, right? Which is that all of these hacks, and again, I'm not even sure I would call all of these things just simply hacks, if that makes sense. All these different techniques and things we can do with exercise, adjunctive treatments, our diets, all of those things are great. It doesn't change the fact that we are designed to be light-based. Now, we sort of touched on melatonin being a great antioxidant. And melatonin's interesting story, of course, is that while 5% is sort of the hormone of darkness, if that makes sense, coming from our pineal gland when it's dark at night, they know that 95% of the melatonin that we have is actually made intracellularly in the mitochondria in response to infrared and red light exposure, which is why you want to get out in the morning and be outside, because that really sets your cells up to be able to repair at night too, because that's where most of it's coming from. So obviously when we get exposed to full spectrum sunlight, one of the things that happens with UV exposure is that it is able to cause the cleavage of POMC, which is propionmelanocortin. One of those, that mega protein, is then cleaved into one of which is alpha MSH, which is melanocyte stimulating hormone. And there are other melanocyte stimulating hormones out there, with one of the products being melanin. And so, as Jack points out, it is both directly and indirectly sort of the ultimate thing in the entire body, which is, we have it concentrated in the brain, and he knows far more about this than I do. Clearly it's doing something there. It's not just there for fun. We have melanin concentrated in a lot of different places around the body and even within our cells. It is the ultimate, it's the ultimate antenna, and that it can suck in radiation of basically every single wavelength, and that it appears to be able to use that energy that it sucks in to do an enormous number of different things around the cell. whether it's related to functioning as an antioxidant, to releasing its own light in its own way and a signaling fashion, to potentially even being able to break the bonds of water into hydrogen and oxygen so that we can use it for respiration. In addition, of course, at the skin level, it acts as in some ways, it can be both an absorber and a protector against the fact that UV radiation can cause, have the potential to cause some damage to our DNA. But of course, remember that our DNA also absorbs UV light directly. So it has something there. So there's melanin, which was always this, avoid the sun, don't get burned. Look, I took on part of my journey for this was doing my own experiment, because Max and others said, you can do a solar callus. All right, fine. Well, I was the kid who only burned. Sunscreen in the 1970s and 80s was that thick, white, creamy stuff that was always super uncomfortable. So I hated wearing it. So I would get burned because I was never, I would go to the beach for 20 minutes. I'd get burned, covered in sand, be uncomfortable. I didn't want to go in the sun. Never had a tan, always super pale skinned. And I said, well, if this solar callus thing can work, going to work on me. So I started last fall with exactly what we talk about. Every single morning I'm out, because when you get morning sun before the UV rays hit, it actually protects your skin against future UV radiation. Like, it's astounding to think about. So it's another flaw in all these stories and all these studies that say the sun is bad. None of them say, well, go out and get your morning sun, because that actually protects you for the future, right? I effectively followed Max's plan and others' plans exactly. Going back to, not so much the minute by minute, body part by body part that those guys in the, early in the 20th century and late 19th century said. And I actually started to tan. Like, I am tan. I couldn't believe it. Not to mention that, and again, my family does think I'm a nut job, probably for a variety of reasons. But I will, when I can, I am out. Like yesterday, I was done in the operating room at a relatively decent hour. And I come home, I flip on my D-Minder app just as a guideline, which just gives people a general guideline. It's not written on stone tablets. And I spent my hour outside, in my bathing suit in the sun when it was 112 here, and tolerated it fine, didn't burn at all. So, when we try things on ourselves that are counter to conventional wisdom and they work, that's really informative. And so the wraparound message, I think, for the audience and for parents and for grandparents and for children who have parents, is that the natural state of what we see in the Western world around us today, of lack of health, that is not our destiny. You don't have to be rich to take advantage. In fact, you don't have to have any money to take advantage of the most simple things. You're not doomed to be taking 20,000 medications forever. Start with the basics. They're actually stunningly hard. But if you're hurting, commit to make those diet changes for 2 weeks. And at the same time, commit to seeing the sunrise, change your evening habits, and get a decent pair, because they're not expensive, of blue blocking glasses for when you're inside all day. And then as you start seeing a change, convert your diet to a no processed food, seasonally appropriate diet. And don't eat after it gets dark. That's it. It's that simple. If we follow that for ourselves and we follow it for our kids, there's no question that there's an enormous amount of suffering we can reduce. I appreciate your opening comments of not always bashing on the doctors, because there's a lot of that and a lot of it's deserved. But when I say it would put a lot of us out of business, to be honest with you, I'm not convinced it would put doctors out of business. It would take some of the doctors who are struggling today but have the right message, and they'd become a lot more successful. And some of the ones who are super successful today just cranking out certain things might have to, pay more attention to try to figure out how we can take care of people better. So There's lots of opportunity. We live in a really uncertain time of the world. You only have to turn on the news, whether our healthcare woes are only a teeny tiny piece of the struggles when you look around. We live in a time of Viktor Frankl. I don't know. You see, I try to finish where I began. That mindset is still before you even get to sitting out in the sun. You have to have a mindset that you have purpose and function in life. Viktor Frankl is a psychiatrist who actually had the opportunity to escape the Nazis, but didn't want to leave his family. Was in the concentration camps and actually survived, and lived a very long time. I wrote a bunch of books, amongst other things, afterwards. But he talks about this existential vacuum a lot, of explaining some of the woes in the world. And this, of course, goes back 30 years because he passed away a long time ago now. Yeah. But if we look at young people, and I guess when you're in the 50s, suddenly young people is any 20 or 30 years younger than me. Young people, there's a lack of purpose or a lack of feeling that there's something greater than yourself. And so start there. Be healthy for yourself. Be healthy because there is something greater. Find something. It doesn't have to be classically religious or theological, although we could use a whole lot more of that. Find something bigger than yourself. Aim to be a part of it. And if you have that grounding so that you're not constantly chasing the next selfie or like on your Instagram or TikTok account, you'll find that these other things fall into place a whole lot easier. And then when you do that, those aches and pains, some of those aches and pains go away, to be honest, even if you're not doing everything we spent the last hour talking about.
Absolutely. Well, Dr. Novack, thank you so much for the time and sharing your story and all the amazing advice. I really, really appreciate it. And, thanks for what you're doing.
Logan, thanks so much for the opportunity. Hopefully people will find it worthwhile, and maybe we'll get a chance to talk again soon.
Thank you for joining us in the Sowing Prosperity mission. If you like this content, like and subscribe, share with your friends. Be sure to check out sowingprosperity.com. Sign up for the email. We've got so much more work to do.